Hello. During this Man on the Move, I'd like to talk to you about one of the most vital undertakings that we are pursuing at Acute Alta, the creation of a new acute care hospital. You and I, as well as our loved ones and other members of the community, never know when we might need the life-saving services of Acute Alta. Heart attacks, strokes, traumatic injuries can happen at any time. The availability of a powerful resource as Acute Alta is with our medical staff is essential to supporting this community's healthcare needs. We are required by California law to meet stringent earthquake standards per Senate Bill 1953. The Mineral King wing of our hospital that was built almost 50 years ago does not meet these earthquake standards. Some 273 of our 403 beds, over 2/3, do not meet these earthquake standards. Our community, our physicians, our staff, and most importantly, our patients would notice the absence of those 273 beds. As you know, on any given day, our emergency department and hospital are overwhelmed with patient demands. We must respond with earthquake-safe facilities for both emergency and inpatient care. It's vital to our community. We will be using every one of our hospital resources to fund the creation of a new acute care hospital immediately west of the Ezekiel wing. We will use our cash reserves, we will use our debt capacity, but we simply do not have the financial resources sufficient to create a new acute care hospital without the community support. While the state of California passed SB 1953, the stringent earthquake requirement bill, it did not fund with one penny the financial resources necessary to accomplish this project. For this reason, we are asking for the community support in the form of a general obligation bond, Measure H. Measure H will be before the community beginning April first week. Ballots will go out, and by May 3rd, our community, those that are registered to vote, will be invited to respond with a yes or no vote to pass a $327 million general obligation bond. This will require an average of $4 per month per $100,000 of assessed valuation. Assessed valuation is lower, and it is not the same as market value of a home. It's what's on the Tulare County tax rolls. This $4 per month per $100,000 assessed valuation represents our capacity throughout this community to support maintaining a vital healthcare resources here in the community. Now, the question has often been posed to me, Lindsay, if the general obligation bond, Measure H, does not pass, won't we just go ahead as we always have done in the past and just make this project happen? The answer is a very clear and definitive no. We will not be able to create a new acute care hospital without the support of Measure H or a subsequent general obligation bond if this were not to pass. Only with the passage of Measure H or another general obligation bond will we be able to maintain the vital healthcare services that our community has come to expect at Acute Alta. In addition, we must maintain our acute care and emergency services as part of our contribution to the economic vitality of this community. It is simply a fact that if we do not create a new acute care hospital, we would have to close many of our vital services. This would have very serious ramifications for healthcare and for the economy of our area. So this comes down to, what can you do? How can you help? As one of our 4,200 staff members and as one of our 450 physicians, I invite you to actively speak with your friends and neighbors about the essential work that we are about to create a new acute care hospital. I am aware also that the Friends of Acute Alta, a group that is separate from Acute Alta, is now working actively on phone banks, precinct walking, trying to help the community understand the essential work that we are about and also to support Measure H. Please join me in actively communicating with your friends, neighbors, and other members of the community about the need for a new acute care hospital here in Visalia. It is vital work. It means that we will be able to continue to provide life-saving care for any member of our community. And again, we never know when we might have an urgent need for vital healthcare services. Acute Alta is moving forward with confidence into the future, and having a new acute care hospital to meet patient care needs is the most essential of the work that we are now doing. join me in this important effort.